What is diabetes? Diabetes is a range of conditions where the body cannot make enough or any insulin, cannot correctly use the insulin that is produced, or cannot do a combination of either. When any of these things occurs, the body is unable to get sugar from the blood into your cells. This can lead to elevated blood sugar levels. Glucose, the type of sugar found in your blood, is one of your main energy sources. A shortage of insulin or a resistance to insulin causes sugar to build up in your blood. This can lead to health complications. The three primary kinds of diabetes are type 1 diabetes, type 2 diabetes, gestational diabetes. Type 1 diabetes. Type 1 diabetes is believed to be an autoimmune disorder. This implies your immune system wrongly assaults and destroys the beta cells in your pancreas that create insulin. The injury is permanent. What prompts the attacks is not apparent. There may be both hereditary and environmental factors. Lifestyle variables are not believed to play an influence. Type 2 diabetes. Type 2 diabetes begins off as insulin resistance. This means your body cannot utilize insulin efficiently, which causes your pancreas to create more insulin until it cannot keep up with demand. Insulin synthesis then drops, which produces high blood sugar. The actual causation of type 2 diabetes is unknown. Contributing variables may include genetics, a more sedentary lifestyle, higher weight or obesity. There may also be other health problems and environmental explanations. Gestational diabetes. Gestational diabetes is caused by insulin-blocking substances that are created during pregnancy. This kind of diabetes only happens during pregnancy. It is typically encountered in persons with pre-existing prediabetes and a family history of diabetes. What is type 2 diabetes? Type 2 diabetes is a lifelong disease that inhibits your body from using insulin the way it should. People who are middle-aged or older are most susceptible to have this sort of diabetes. It used to be called adult-onset diabetes or diabetes mellitus. But type 2 diabetes also affects kids and teens, mostly because of childhood obesity. Type 2 is the most frequent kind of diabetes. About 1 in 10 people in the US have type 2. Nearly 1 in 3 have prediabetes, meaning their blood sugar, or blood glucose, is high but not high enough to be diabetes yet. Symptoms of type 2 diabetes. The symptoms of type 2 diabetes can be so minor that you don't notice them. About 9 million individuals have it and don't realize it. Symptoms include being very thirsty, peeing a lot, blurry vision, tingling or numbness in your hands or feet, fatigue/feeling worn out, wounds that don't heal, yeast infections that keep coming back, feeling hungry, weight loss without trying, getting infections. If you experience dark rashes around your neck or armpits, visit your doctor. These are termed acanthosis nigricans, and they can be symptoms that your body is developing resistance to insulin. Causes of type 2 diabetes. Usually, a combination of things produces type 2 diabetes. They might include genes. Scientists have uncovered distinct sections of DNA that control how your body generates insulin. Weight. Having additional weight or obesity might induce insulin resistance. Metabolic syndrome. People with insulin resistance often have a set of disorders including high blood sugar, high blood pressure, and high cholesterol and triglycerides. Too much glucose from your liver. When your blood sugar is low, your liver manufactures and sends out glucose. After you eat, your blood sugar goes up, and your liver normally slows down and stores its glucose for later. But some people's livers don't. They keep manufacturing sugar. Bad communication between cells. Sometimes, cells send the wrong signals or don't pick up messages appropriately. When these abnormalities influence how your cells generate and use insulin or glucose, this can lead to diabetes. Broken beta cells. If the cells that generate insulin send it out at the wrong moment, your blood sugar becomes thrown off. High blood sugar can harm these cells, too. Type 2 diabetes risk factors. Certain things make it more probable that you'll have type 2 diabetes. The more of these that apply to you, the higher your chances of acquiring it are. Some things are related to who you are, age, 45 or older, family, a parent, sister, or brother with diabetes, ethnicity, African American, Alaska Native, Native American, Asian American, Hispanic or Latino, or Pacific Islander American. Risk factors related to your medical history and health include insulin resistance, prediabetes, heart and blood vessel disease, high blood pressure, even if it's treated and under controlled, low HDL, good cholesterol, high triglycerides, being overweight, or having obesity, having a baby who weighed more than 9 pounds, gestational diabetes while you were pregnant, polycystic ovary syndrome, PCOS, depression. Other things that raise your risk of diabetes have to do with your daily activities and lifestyle. These are the ones you can do anything about: getting little or no exercise, smoking, stress, sleeping too little or too much. Type 2 diabetes epidemiology: some 462 million individuals globally, or about 6.3% of the population, have type 2 diabetes. It's the 9th biggest cause of death, responsible for more than 1 million deaths each year. Cases of type 2 diabetes are increasing quicker in industrialized countries like the US and Western Europe. Scientists say type 2 diabetes affects men and women at nearly the same rate. It's more common in adults in middle age and older, affecting 4.4% of those ages 15 to 49, 15% of those ages 50 to 69, 22% of those 70 and older. It's also more common in persons of race, especially those whose heritage is Black, Hispanic, Native American, Asian. Type 2 diabetes diagnosis and test. Your doctor can test your blood for indicators of type 2 diabetes. Usually, they'll test you on 2 different days to confirm the diagnosis. But if your blood glucose is very high or you have several symptoms, one test may be all you need. Blood testing for type 2 diabetes include A1C. It's an average % of your blood glucose during the past 2 or 3 months. Fasting plasma glucose. This is also known as a fasting blood sugar test. It measures your blood sugar on an empty stomach. You won't be able to eat or drink anything except water for 8 hours before the test. Oral glucose tolerance test, OGTT. This checks your blood glucose before and 2 hours after you drink something sweet to observe how your body handles the sugar. Stages of type 2 diabetes. Researchers have established 4 stages of type 2 diabetes.